I just mentioned that Kamal took me to the outreach program on Monday, by Kanji. I was very, very impressed with what I saw there. And I was wanting to know, basically, is this a regular event that you go out to different regions and understand what illnesses exist?
Well, we do extensive outreach programs in not just the regions, but in each community. We focus a lot on the vulnerable communities, what we call the underserved or the unserved regions and the communities. The concept here is that we take health to the people, and even though we promote a program that people must take responsibility for their health, we believe that the individual's health is a partnership of people taking responsibility.
Yeah.
But in spite of taking responsibility for their own health, there are certain things they can't do. And so we empower people by being present. That's what we believe in.
Okay.
And so we come to people and we do health promotion. We try to teach them good hygiene, basic things that have been with human beings all our lives.
Yeah.
Some of the simple things that me as a child had to go through in school, good basic hygiene.
Yes,
we
yeah.
underestimate really what good hygiene does, and so we go there.
Well, we do outreaches as part of our, I think you should talk to Minister, we do outreaches as part of our program, regular program. We go once every 6 weeks to our reality. Every month we go at the bank. Every month we go in Blackbush as a hospital, but it's spread out. And every other week we go to the other 2 locations in Blackbush. We visit Barakara every 6 weeks. So all the hinterland locations we cover. Now and again, we would, if there is an outbreak of diarrhea or whatever it is, locally, even on the coast, we go there as a team.
Basically, today we are here at Gangaram.
Yeah.
It's a BCA outreach, the Berbice Arsenal outreach.
Yes.
We'll be screening and seeing patients today, and we'll be treating them as well. Also, elderly patients, we'll be seeing them and enroll them into our shopping program that we have currently going in all the different places in Berbice. So patients over 70, we will enroll them into the shopping program, and they will be visited monthly by the Berbice Regional Health Authority.
You say the shop, how do they know about what you're doing?
Outreach?
Yeah.
Well, we use basically community-oriented people. We use our health workers, we use religious leaders.
So they're the ones that diffuse the message that you'll be having a session.
There. Same though, like for example, if we go into the hinterland area, we use our community health worker based on that, in that specific area to pass the message on. And for some areas, like for example, Mara, we have a schedule every month we go in. So the people expect us, so they find out.
Do you know in advance what kind of patients you'll be seeing, or?
We're prepared for all cases. We're
Yes.
prepared to handle all the cases. Whether it be elderly or children or adults, we're prepared to handle everything.
But I guess you can't handle, serious cases.
Yeah, we could. We get them straight. If it's a case that we need to send to the hospital, we send them to the hospital because we will evaluate that on the spot. And like I told you,
We believe that there's a fundamental right to certain things, vaccine for example. So in Guyana, unlike the developed world and many developing countries, vaccine is a public good. So every child is given all of the relevant vaccines.
Okay.
Right now there are 15 antigens that we provide our children with for free. And that includes all of the traditional ones, polio, measles, smallpox. Smallpox is now having been eliminated worldwide. It's no longer a vaccine that is provided around, but it is available. But all rubella, diphtheria, pertussis, all of them. So recently we've added rotavirus, we have added pneumococcus, there is hepatitis B. All of the relevant vaccines is provided to every child in Guyana for free. And whilst we have our health centers and the hospitals and serving all the communities, and people are supposed to bring their children, we don't take chances. We come also to find them. The team comes around with doctors and nurses and medics, and so we could look at chronic disease, which is really the #1 problem we face. The traditional chronic disease, diabetes, hypertension, cancer, these are all diseases. And when we go out there, we ensure that they have their medication. We provide all medicines for free. We're now bringing laboratory tests closer to people. The outreach program is really a program that links the people in their homes to the health centers and to the hospitals. In this region, Region 6, we have started to pilot another national program, which is the extended home-based care. So we have a dedicated team visiting homes where there are elderly people who may have difficulty moving around, what we call the shut-ins and the disabled. We want to ensure that issues such as maternal mortality, under 5 children mortality, and so are things of the past. And so, the tradition here has been that people wait till they're overtly pregnant, till like 6 months or something to go, and we have changed that. So right now about 30 to 40% of people, women when they're pregnant, actually join the clinic in their first 12 weeks. But that leaves a sizable number that comes after the 12 weeks. And so one of the other purpose of the outreach is to ensure that if we find women like that, we get them to join the clinic. And because of that, Guyana's life expectancy I don't know when you left Guyana the first time.
The first time I left in 65, I think.
You left before me.
Okay.
So, in about 65, Guyana, as we approached the 1960s, all of us were either children or teenagers. Guyana was anticipating reaching a life expectancy of 60 in Guyana. So, and that was an exciting time for those of us who paid attention to those things. From 1965 to I would say about 75, we made some progress, continuing the progress from the 1940s. And we had actually passed life expectancy of 60. But by 1991, we were flirting with dropping below 60 again. And at the end of 2008, we reached a life expectancy of 70, at 2008. So we made substantive progress since 1990 to now. And part of it is because we're bringing health to the people. And our goal is that by 2015, our life expectancy will be 75. We have reduced maternal mortality.